Welcome to the Business Talk podcast. I am your host Deepak. We are delighted to welcome the highly esteemed Dr. Matthew Kurian to join us today. Dr. Matthew Kurian is a dedicated hematology oncology physician at St. Elizabeth Healthcare and is an assistant professor of medicine at the University of Kentucky College of Medicine. Specializing in breast and genitourinary cancers, Dr. Kurian has a wealth of experience with radioligand therapies, particularly Lu-177. He completed his oncology fellowship at the NCI designated university, hospitals, Case Comprehensive Cancer Center, where he served as the chief fellow of the Hematology Oncology Fellowship Program for 2022-23 and has numerous peer-reviewed publications to his name. Beyond clinical practice, Dr. Kurian is passionate about narrative medicine, medical education, and improving clinical trial access in community settings. As the Cancer Center Physician Liaison at St. Elizabeth and a member of the Executive Committee of KIOSCO, the state affiliate of OSCO, he aims to enhance the availability of GU and breast cancer trials in his region. He previously taught at Case Western Reserve University School of Medicine, earning the 2023 Fellow Teacher of the Year award and being inducted into the Academy of Scholars. In this episode, Dr. Kurian will explore his expertise topic, transforming cancer care, how AI, precision medicine, and innovative therapies are shaping the future of oncology. Dr. Kurian, it's an absolute privilege and pleasure to welcome you to the podcast.
Thank you, Deepak. I appreciate being on here and speaking to everyone.
Thank you, Doctor. Doctor, can you describe how the landscape of cancer care has changed in recent years, particularly with the advent of AI and precision medicine?
Yes, it's a good question. I think that within the field of oncology, I think we've really taken a leap, I would say, in terms of how we manage cancer nowadays, as opposed to potentially maybe only 10, 20 years ago. Essentially, our treatments have very much advanced in the sense that chemotherapy was typically the main treatment for majority of all cancers. And essentially, chemotherapy is still part of a lot of the treatment that we give every day, but now our treatments have become a little bit smarter and a little bit more targeted. With the advent of immune treatment or immunotherapy, which utilizes the body's own natural immune system to attack the cancer, targeted treatments where we specifically identify things within the cancer that make it tick and specific genetic mutations, and then create drugs that target those mutations and have far less side effects than traditional chemotherapy. Both of these new treatments in terms of immunotherapy and those targeted treatments that are sometimes pills that folks can take actually have really improved the options we can provide patients nowadays.
What specific roles does artificial intelligence play in cancer diagnostic and treatment planning? Are there any examples where AI has significantly improved patient outcomes?
It's a great question again. I think that AI is really touching various aspects of oncology in all different settings from the very beginning, from when we diagnose someone. We are now using AI to help us identify. For example, in my world, I see a lot of breast cancer. We have a lot of different programs that are integrated within our electronic medical records that can actually identify areas on mammography that are maybe higher risk for developing breast cancer and flag those for our radiology doctors who look at these mammographies and identify breast cancer. And there are many studies now supporting that sometimes AI can actually do it better, than the average radiologist that may have many years experience essentially in finding things they may have not seen as well too. So that's one application within lung cancer. Same thing. There are programs out there now that are identifying lung nodules for people, that we know are maybe at risk of lung cancer because of a prior smoking history. Identifying them, quicker and faster, than some of the lung doctors and radiology doctors as well too. So from a diagnosis standpoint, there are many things, within that realm that can help with a diagnosis standpoint as well. Identify areas that may have not been traditionally caught by the human naked eye. And then in terms of, pathology and making the diagnosis, a lot of times we need a sample of that cancer to understand what it is exactly. And AI, is now being used in many different platforms, specifically in my world, prostate cancer, and now even in breast cancer stuff, where we can identify, exactly how that cancer may behave potentially 5 years from now, potentially, just by a computer analyzing, the characteristics of what we see on a biopsy result, um, and maybe giving us more information about how potentially we may be able to treat that patient, better potentially up front as well. So from the, radiology side and looking at, images of, where cancers are through CAT scans or PET scans, it can improve accuracy within pathology itself, and identifying what type of cancer it is and how aggressive it is. It can help with that as well too. And a lot of these programs, I think within radiology, they're already being used already now every day. And then within pathology, I'm making the diagnosis. Some are being used within prostate cancer already, and then others, are just early on in trying to make their way in and help, improve the accuracy as well. And then when you talk about treatment as well, being able to predict what type of treatment someone may respond to, and potentially, helping with drug discovery as well, and trying to understand exactly potentially, what molecules and may be the best to target a specific type of cancer, essentially. If you've heard of, how the Ebola drug, that helped combat, Ebola was discovered was actually through artificial intelligence, actually, through a collaboration with IBM in the University of Toronto. And essentially, what they did when there was an Ebola outbreak, essentially, they used an AI program to screen, over 6,000 different molecules to see whether or not they could find something that they can make a drug to target a specific protein from the Ebola virus to prevent it from entering the cell, essentially. And so as a result of that, the AI was able to do that work within a day span of time, whereas traditional ways of doing that may have taken potentially years to find that treatment, essentially. So AI is very, very, very fast in terms of the amount of information it can collect, and then be able to screen for potential compounds much quicker than the normal human can, and look for potential treatments in the cancer world very quickly as well too. So I think that these are just a few applications of how it can really be used. I think it's only the tip of the iceberg in that setting.
Yeah. Dr. Matthew, how does precision medicine differ from traditional cancer treatment approaches? And what are some of the most promising targeted therapies currently being developed?
Yeah, definitely. I think that, within, we say the word precision medicine, and the way that, I describe it to patients and other folks really is identifying exactly genetically what makes the cancer tick. So specific examples, that have been advancements within oncology within the last few years really have been, advent of EGFR, mutation in lung cancer. So that's a genetic mutation that's found within lung cancer that we've now created many different drugs for, essentially, that are pills that individuals can take with even advanced lung cancer, and still have an excellent response to treatment. Potentially, curing some folks that had, very advanced lung cancers without using chemotherapy at all as well too. And so the EGFR mutation is an example of how we target a specific genetic mutation that can be seen across a specific type of lung cancer, and then use that to make a treatment for lung cancer that works very well. Um, and so there's many other, similar sort of stories within different types of cancers. Within breast and prostate cancer, there's an advent of what we call PARP inhibitors that target another pill that can target a specific mutation for people that may have what we call BRCA1 and 2 mutations, that are genetic mutations that are seen in a large majority of folks that may have hereditary, cancers as well. And having that mutation, we know that we can target it, and essentially those folks can respond very well to treatment as well in different settings. Melanoma, we use a targeted treatment called BRAF or MEK inhibitors as well. That's revolutionized how we've treated melanoma. So many, I think, applications, and I think that now I think what we're seeing now is sort of the next wave of that. Now we're identifying many other mutations and trying to find drugs for each specific type of mutation, Now we're looking into preventative vaccines for folks, with triple negative breast cancer, and then folks potentially having more targeted treatments for maybe less toxic chemotherapy as well too. So I think that within precision medicine, I think that it really has been a game changer within the oncology field.
Doctor, how can AI and precision medicine be integrated into existing treatment protocols? And what
Yeah,
challenges do oncologists face in implementing these technologies in clinical settings?
good question. I think that already, what I referenced in terms of radiology being already AI being used within radiology, is already integrated already within, the oncology landscape. We're using that, for folks with breast and lung cancer as well. And I think that, being able to integrate that into our current systems and electronic medical records that radiologists can look over what the AI has potentially flagged as well as potentially being high risk um, as well, and potentially identifying, markers that may make a person higher risk for their cancer coming back as well. That is already being used as well. And I think that from a clinical side, I think, the thing that, I would like to see more of, and I think is coming as we, see in more and more of these programs being used in different settings, is helping me as a medical oncologist make decisions regarding treatment. And using that information that is found on radiology and found on pathology and using it to predict exactly not only what treatment may be the best, but being able to, if the treatment doesn't work, switch treatments as well, and helping sort of figure out exactly the next steps would be the next wave, I think.
Yeah. Doctor, can you share any data or studies that highlight improvements in patient outcomes due to the adoption of AI and precision medicine on oncology?
Yes, it's a good question. I think that there's one that I'll share specifically that is a program called Artera AI. And it essentially, looks at folks with prostate cancer and excuse me. And the way that prostate cancer works is that it feeds off of testosterone in a large majority of settings. And so a backbone of our treatment is using hormonal treatment. And those that have localized prostate cancer, we know that sometimes the addition of hormonal treatment may benefit, folks to prevent their cancer from coming back. And essentially, this AI program called Arteria AI, was developed to see exactly who really benefited from that hormonal treatment and basically looked at using AI to look at digital pathology slides for folks with prostate cancer and be able to look at different features within that, within that slide, within that, information that's taken from a biopsy result, and be able to predict whether or not someone may benefit from hormonal treatment or not. And that is truly groundbreaking in the sense that, we can use that information to really make patient decisions in real time as well too. And it has had validation with it as well. And I think that's the question. I think that I think that with any program, that I always ask is what exactly is the validation behind some of what supports its use exactly? Because these tools are only as good as the information that it draws from as well. So if you have something that is potentially maybe a false source of information. And I've done some work and training some AI systems as well too. It's something we call a hallucination rate, and sometimes AI, in a lot of sense, can be wrong at this point in time as we get more and more information. And it's important to know exactly where you're drawing that information from. Is it accurate in terms of the population? And making decisions regarding all different aspects of the population. And, how is that, data secured as well? Are implications and things that I think that anyone that is involved with AI really needs to understand exactly how to safeguard those things.
Doctor, what ethical considerations should we keep in mind when using AI and personalized treatment in oncology? How do we
Mhm.
ensure that this advancement benefits all patients equitably?
Yes, and I think we just sort of just dove right into that in the sense that there have been some instances where AI may not potentially represent all groups fairly, in the sense that if you have, say a data set that is only specifically looking at all Caucasian, individuals, is that enough information to draw conclusions about someone that is African American? So that I would say no, based on the information that you need, a data set that represents the people that you're treating every day, essentially. And so it needs to be diverse, it needs to be enriched in that setting. And you can make the wrong decision and come to a wrong conclusion as a result of that as well. And then, like I said, privacy concerns are something that where are we storing this information exactly, and how is it being, protected essentially? Because this is information that not only has information regarding people's age, health problems, cancer, things like that as well. All their medical information. How is this information being stored, and who has access to this information as well is a big concern that many people raise regarding the use of AI across the board as well. Because as we get more and more data, the thing is that, we want to make sure that data is being securely stored and that it's representative of the population. I think those are the two most important things, that we need to consider ethically.
Doctor, what are some of the major challenges that the oncology field faces as it continues to adopt AI and precision medicine technologies?
Yes, I would say that, I think the biggest challenge would be validation. I think, with when AI tools are rolled out, there are many companies that are trying out the different AIs and making their own programs in different settings, not only just within oncology, but in other aspects as well too. And the point of, AI, I think within the healthcare space, really, I think first and foremost, I think is to help patients, but I think that that is a downstream, effect essentially. I think that, what needs to happen first is to make sure that, the programs, that we're using, have been studied in a prospective, randomized way where that we're not biased by exactly, what the AI is saying exactly. And so a lot of work now is being done to use these tools, and folks like myself are blinded from the results to see exactly how things work first, get more information about how well it truly works or doesn't work, and then potentially use it in clinical practice after that as well. So I think that it needs to be studied in a way that it's not going to, at least in the beginning, is not going to bias my decisions, initially. So it needs to be studied that way first, and then it can be used after that once that there's information that supports its use essentially after that. And then, once it is able to, be validated, then I think we can, start to use these tools in real practice then. And then that will downstream affect patient outcomes as well, in the end as well. And the hope is that by using AI, it makes our lives easier as clinicians to help make decisions easier, faster, and better.
Doctor, how important is collaboration among oncologists, researchers, and AI expert in
Yes.
driving advancement in cancer care?
Yes, and I think that collaboration between researchers and the folks that make these programs, I think, is very crucial in the sense that if you have someone that is a programmer that is just making the program and doesn't understand the clinical implications of the information, and how do they code the AI to interpret what data exactly, and what goes into the decisions, or information that looks over regarding radiology, pathology, and then the clinical aspects, and the patient's age and other medical conditions. How does it put that all into one package essentially? And so it's important, I think, for developers to know exactly what I do, in terms of what decisions I make, and what are the variables that I think about when I make decisions, to implement that into decision making as well. Because if they're looking at a completely different set of variables than I am, it may not be something that may be as applicable as a result of that as well. There definitely is, opportunities, I think, to improve, some of the AI programs we have out there. But I think it really has to come back to, exactly how is it going to benefit the patient? How is it going to help me make a decision, easier. Because if there's more variables within that I'm not sure exactly what to do with, then it may make my job even harder potentially as well, and it may complicate things. So that's something to consider as well.
Doctor, looking ahead, what do you envision for the future of oncology? How might AI and innovative therapies evolve in the next decade?
Yeah, I think it's a very exciting time, I think, with the oncology in the sense that, I think that we are moving away from traditional chemotherapy that has been associated with a lot of toxicity and side effects that is very well known across the board to many patients, and many patients are very apprehensive regarding some of those treatments, especially as they age. Nowadays, I think that, with the addition of precision medicine and targeted treatment with pills, side effects are lessened, treatments are more effective with less side effects, and then using immunotherapy. And then now there's a whole wave of new medications, radioligand treatments, that I've had some experience with, using targeted radiation with a molecule to deliver treatment, preventive vaccines, immunotherapy, antibody drug conjugates. So we're in a whole different, new era, I think, for oncology, that things are evolving very rapidly. And I think there's a lot of opportunity for a lot of clinical trials as well that will help us answer exactly how do all these treatments fit together, and what's the correct sequence of how we treatments better up front.
Doctor, my last question. What advice would you give to patients who are interested in learning more about how these technologies might impact their treatment options?
Yeah, definitely. I encourage people, when they are diagnosed with a different type of cancer, to try to look up and see exactly, if there are any, programs or clinical trials, that may explore this question, because I think that, it's information that may help, a patient's journey, but it'll also help, everyone, in terms of understanding exactly how these programs fit in. In terms of, educating oneself, there are many journals, that are out there essentially that that are patient friendly as well too, that can help educate patients about the latest and greatest technology and exactly whether or not certain tools should be used. So GM Oncology has a patient education section that and they've also recently added an artificial intelligence section, and there's a patient education section that I've contributed before regarding how AI works and educating patients about how AI works within oncology. So that's a great resource. There are other journals like the one that my boss Doug Flora, who's the executive director of our cancer center at St. Elizabeth's, has created a journal called AI and Precision Oncology that is doing that to not only educate healthcare providers but also patients as well too. And I think that's an excellent resource as well. And there are many other online resources that involve major medical societies like AACR, JCO, ASCO, and other bigger societies that want to put education out there to patients, because we know that these tools are now starting to become used within clinical practice. It's important for patients to understand exactly what these tools are, how they're validated, and why we're potentially using them as well.
Thank you for joining us today on this enlightening episode featuring the esteemed Dr. Matthew Kurian. We are grateful for the insight he shared on the transformative role of AI, precision medicine, and innovative therapies in oncology. His commitment to improving clinical trial access and his passion for narrative medicine highlights the importance of patient-centered care in our evolving healthcare landscape. As we move forward, it's clear that the integration of cutting-edge technologies in cancer treatment holds great promise for improving patient outcomes and challenging traditional models of care. Thank you once again, Dr. Kurian, for being with us today, and thank you to our listeners for tuning in. Until next time, take care and stay healthy. Thank you so much, Dr. Kurian.
Thank you. Appreciate it. And thanks for having me on. And it was a pleasure to talk, and happy to take questions later on as well too.
Thank you.